I am William Davis Gaillard. I am professor of pediatrics and neurology and chief of child neurology at the Children's National Medical Center here in Washington, D.C. And I also direct the epilepsy program. And as we are in Washington, D.C., we are in the United States of America. This was a fabulous meeting with wonderful international speakers that provided many insights that will hopefully be helpful to children and families who care for children with HH. One of those was insights into the anatomic origins of hypothalamic hamartoma and how, based on the anatomy and physiology of the hypothalamus, that may explain some of the symptoms that children exhibit, particularly their seizures, in relation to brainstem structures. Linked to that were advances that were presented at this meeting looking at the insight from the genes that regulate brain development that may be responsible for the formation of HH. This is particularly important because there are other models based on brain tumors and other pediatric neurologic diseases such as tuberous sclerosis, where identifying a gene pathway may also be a target for future intervention, and that intervention may conceivably, as it has been for some brain tumors, to reverse what was thought to be permanent neurologic deficits. And there is evidence from tuberous sclerosis as well that interventions either in early treatment of epilepsy or in the pathways that form tuberous sclerosis that hold the prospect for being disease modifying for long-term outcomes and consequences. A major focus of the symposium was on comorbidities in children with HH and older patients with HH. And there were a number of important observations. It has been well known that there seems to be a progressive deterioration in epilepsy control and in behavior and cognition. But it's also apparent that, that many behavioral and cognitive difficulties predate the onset of epilepsy. And that makes it more difficult but important to disentangle the relationship between the underlying cause, which is probably the genetic difficulty, the disorganization of those brain regions, the epilepsy, and the connections of that abnormal area to the rest of the brain. It is also seems that those children in whom you achieve seizure control seem to do best in terms of cognition and behavior, but paradoxically there are too many children in whom one achieves seizure control, but one does not gain the benefit of improved behavior or cognition, and that is an area that we need to work on very much. If you look at children with epilepsy in general, and children with HH with epilepsy, their cognitive profiles are very similar. There's a very high incidence of comorbidities in terms of attention difficulties, intellectual disability, anxiety, and depression, and those seem to be relatively common or similar between children with other epilepsies and HH. But what seems to distinguish the HH population is possibly an increase in autistic spectrum disorder symptoms, but most importantly, rage. So a major outcome of this symposium is to put efforts together to try and characterize what the rage and the aggression is, because that seems to be underappreciated by healthcare personnel, but is what is very disruptive to a child's life or to family life, to be able to characterize it and then to work on interventions to ameliorate those particular symptoms. Another finding that came out from this meeting is what seems like a number of children who have died from SUDEP, which seems to be overrepresented in this population, but that needs to be investigated. And that's important not only for the care of those children, but also because of the linking of the hypothalamic hamartoma to brainstem mechanisms. It may shed insight into mechanisms of SUDEP, which could be applicable to broader populations. And it would be really, really great to be able to mitigate or decrease the likelihood of death from these conditions. So one of the outcomes from this meeting is a determination or consideration of what needs to be done going forward, and a number of working groups have been devised, but what was clear was a need for some kind of understanding or consensus regarding guidelines for diagnostic criteria, early diagnosis, appropriate imaging sequences to identify hypothalamic hamartoma, and more importantly, to stress the need for standardized not only cognitive assessment, but also behavioral and mental health assessment. So having a comprehensive evaluation by a neuropsychologist and an evaluation also probably by psychiatry. One of the other findings from this meeting are the outcomes from various medical and surgical interventions. Medical interventions are notoriously ineffective, although some medications may be more effective or less effective than others. Surgery has its benefits in being relatively similar about seizure outcomes, but they differ in their outcomes in terms of complications and what are really post-operative morbidities, and those mostly being memory deficits and obesity. So current technology has increasingly worked towards minimizing those complications from surgery, and that is really terrific. But that bears further investigation, and the effects of these approaches on what is important is for us to be able to determine which particular surgical intervention is optimal for a particular child's size and location of their hamartoma and their particular cognitive or behavioral profile to try and optimize their outcomes. We have worked or will work to try to come to an understanding for what the optimal pre-surgical and post-surgical evaluation should be, not only from a neuropsychologic perspective, but also from a psychiatric perspective, and also from an endocrinologic perspective, so that we can identify children who are at risk, to identify difficulties early in the post-operative course, and to intervene appropriately. What is important about an international research symposium is this offers the opportunity to bring people who are experts from around the world, and they may have, or they do have, expertise in areas that may not seemingly be related to HH. But because of their expertise in genetics, or physiology, or psychology, or neuropsychology, or endocrinology, they are able to bear their experience on the children and adults they care for that may be applied to an improved understanding of HH, and also to devise better treatment and intervention for those children. Furthermore, people are able to share their ideas, and that is cross-fertilization that improves other people's care and brings people effectively into a cauldron to generate ideas that will then advance the things that we need to do to organize ourselves to improve our care of children with HH and to care for their families, and also to establish what a research mission should be to advance information on gaps that currently exist, so again that we can improve care for these children.